Hi everyone, it's Connor here from Durham Hearing Specialists. I hope you're doing well and welcome to a different video today. We have a paediatric case here. This is a child under 10 years old who presented with severe ear pain. So the child woke up with severe ear pain a couple of days ago. And as you would expect, the parents were very concerned, took the child to an urgent care centre, and the doctors there looked the child over, assessed the case, and they felt that it was not a medical emergency and no medication was needed. But of course they did pick up that the ear was full of wax and debris, and unfortunately they did not, for whatever reason, they didn't have the facilities to deal with it. So they advised the parents to go away, apply some drops and find a microsuction clinic to get it extracted. So over the next 2 days, the parents are desperately phoning around, any clinic that they can find on the internet to see if they can get their child seen. So they phoned around lots and lots of different clinics, including some private hospitals, and nobody would see this child. So, in the course of doing their rounds, they came through to Durham Hearing Specialists, and of course I said I would see the child at the end of the day. So that's what you're seeing here, this child's ear. And, whilst it doesn't look severe at the moment, this is merely just the first third of the blockage. So this, gigantic plug of wax and dead skin extends right down to the eardrum. And what you will see once everything is removed is an acutely inflamed canal and eardrum. So it really does look very sore and very angry. But there is a happy ending in the sense that the child afterwards was extremely relieved and happy, and the pain was gone. So it does end well. But again, we're just fighting to get this debris out here. Now you may be thinking at this point, well, why does it hurt if there's no bacterial infection, if there's no puncturing of the skin or cut or bleeding or noxious chemical substances? What's causing the child so much aggravation and pain? And I rather think it's due to the pressure of this earwax plug. And what you'll find is that typically when the lumen of the ear canal is totally full, so the ear canal is full and there's no more room, what you'll find is if you apply water-based drops or you allow water into your ear, the plug will probably expand a little bit because it's absorbing some of that water, and that will lead to an increase in pressure within a very short space of time, which can hurt. So here we have just some bonus material, I suppose. We have some golden glitter in the ear, which is rather unusual. The child was not aware of this and had no idea how it got in there, but I'm assuming that maybe at some point he was doing some arts and crafts and maybe putting some PVA glue down and putting some golden glitter on top, something like that, and somehow it's made its way into his ear. But I don't think this has any bearing on the pain aspect. But yeah, so I think it's primarily due to pressure, and pressure can elucidate pain. And in this particular case, what is probably happening, well, there are probably two things happening. First and foremost, the mechanical strain, the pressure that the plug is exerting on the skin and the periosteum, which is the covering of bone. It's like connective tissue, which wraps around bone like cling film. There will be pain receptors in that tissue, so they're called nociceptors. And you have nociceptors all over your body. It's in your bone marrow, your skin, obviously, your muscle. And nociceptors are responsible for transmitting pain signals to your brain. And you have different types of nociceptors. So you'll have nociceptors which are sensitive to heat, chemical agents like capsaicin from chili and so on, and mechanical forces like pressure. And in the case of the ear, well, if you compare it to your forearm, for example, so if you get your forearm and press down in it like this and squish it, so if there are any phlebotomists watching right now, you might be interested. But if you squish your forearm like this, you'll see it's obviously quite bouncy and springy, and it's able to withstand compression to a degree because there's lots of fat and muscle there, which acts as a cushion. In the case of the ear, the inner 2/3 are basically skin on bone. So you have a very, very, very thin layer of skin, periosteum, and then bone, which is not able to withstand a huge amount of compression. So what's probably happening in the first instance is that the pressure, the mechanical pressure created by this plug is probably stimulating those nociceptors in the bony portion of the ear canal. But there's something else that's going on, probably, and that is that, well, definitely, there is inflammation due to tissue damage, probably. So, and by tissue damage, I don't mean that you're going to see lots of necrotic flesh everywhere, but when you have this pressure, it's not unreasonable to assume that there will be some damage to cells. And when you have damage to cells and the cell splits and then the contents of that cell leak out, that will be detected by your nociceptors, and your nociceptors will fire and give you elucidate pain. But the contents of these ruptured cells, these damaged cells, will also be picked up by resident white blood cells in the area, and that will kickstart inflammation. And the reason that that's relevant in this case is because when you have inflammation, your nociceptors will become more sensitive. So that the threshold of excitation of your nociceptors will lower significantly. And that's created by a special molecule called bradykinin, which is very interesting. And that will be created or produced, secreted by white blood cells where the area of tissue damage is. And so bradykinin will come along and interact with a receptor on the surface of your nociceptor called a TRP1 receptor. And bradykinin, interestingly, is also a vasodilator. So if you are diagnosed with hypertension or heart failure, then your doctor might prescribe you ACE inhibitors, which is a type of drug which interferes with the degradation and breakdown of bradykinin. So it increases the amount of bradykinin in your body, basically, which helps with vasodilation, which helps with hypertension, as you can imagine. So here we are. Again, this is the last piece that I'm struggling to get out of this ear. And I'll show you what all the debris looks like next to a ruler. But again, I would emphasize that obviously a child's ear is going to be a lot smaller than an adult's ear. Now, because we're looking at it through an endoscope, this looks like any other video on the channel, but all the other videos on my channel are of adult ears, significantly larger. So we're working in a very small space here, and all this debris is confined to a very small space and is putting pressure in a very small space. So it's understandable why there's so much discomfort here. So here's the last piece of debris. And I just, an honourable mention to the patient at this point. He was so brave. He was an absolute trooper, and he was able to sit still. I gave him a couple of breaks, but he was very, very good, a model patient. So there's the eardrum back there. I mean, it's almost unrecognisable, really, compared to a normal eardrum. There are some skin adhesions to the drum, and obviously it looks very red, inflamed, and angry. But after the procedure was over, the patient was, pain-free, very happy, a different child. So, the procedure was a success, essentially. Here's all the debris. And this is all out of one ear, out of a child's ear, which is, significant. Here's all the debris that collected in the tube. And there was a lot more debris that sucked into the canister, which I won't show you. But you can understand, even without going into all the science of nociception and pressure and chemicals and bradykinin and things like that, you can understand why an ear full of all that can cause discomfort and fullness and distress. So there we go. I thought that was a very interesting case, and it was also a very good excuse to talk about nociception and things like that, which I find very interesting. And what's also very interesting about your nociceptors in your body is that if you have tissue damage, your nociceptors, as I said, can pick up on that, but your nociceptors will also release chemicals which will stimulate your white blood cells to start that inflammation process. So your nociceptors are almost, a very important part of that inflammation pathway. So there we go. I hope you found that interesting and useful. If you have any questions, leave them down in the comment section below, and I will try my very best to get back to you. Thank you for watching, liking and subscribing, and of course, I will see you on the next video.